Hello, everyone. I'm Dr. Carmen Puliafito, and welcome to Retina Synthesis. Today, we have as our guest Dr. Philip Storey of the Austin Retina Associates. He gave a very provocative talk at the American Society of Retina Specialists annual meeting, where he discussed the characteristics of eyes that did well after treatment with a tyrosinase kinase inhibitor. And I would say this is an important issue. There are 2 TKIs in clinical investigation right now, and everyone wonders what's the best way to use these agents in our management of neovascular AMD. And your study provided some real insight into that. Welcome to Retina Synthesis, Philip.
Thank you, Carmen. I really appreciate you having me on the show.
Can you tell us a little bit about EY-1901 and the Davio trial for our listeners who may not be familiar with that?
Certainly. So EYP-1901 is vorolanib. It's a potent pan-VEGF receptor inhibitor, blocks all 3 forms of VEGF. And in this study, it uses the Durasert technology, so it lasts about 9 months. And the study was interesting because it allowed previously treated patients that had dry maculas into the study. The concept was EYP-1901 was given, followed by an injection of aflibercept, and then we watched to see how long it took for fluid to recur, and patients did remarkably well. At 6 months, only 53% of patients needed, about half of patients were supplemental free, 53% didn't require additional injections, and all the way out to 12 months, 35% of patients were injection free. So this is really sort of a long-lasting intravitreal injection that doesn't replace anti-VEGF therapy, but is really a supplemental treatment to really delay the need for additional injections.
What's the timing of aflibercept in the study and going forward?
Good question. So in Davio 1, aflibercept was given 1 week after EYP-1901 was injected. That has subsequently been changed. We're now, we've fully enrolled Davio 2, which is the phase 2 clinical study. And in this study, we actually did the injections on the exact same day. And I suspect that that will be what we do moving forward. Phase 2 data, top-line data is expected by the end of the year. After that, I fully expect that they'll move forward with Davio 3, doing injections on the same day for a patient, mostly for convenience sake.
So tell us what your analysis showed.
Good question. So we were really looking at 2 different things. Number 1 was reduction in treatment burden. We compared the number of injections that patients needed prior to enrollment in the study to the number of injections after they received EYP-1901. And there was a 75% reduction in therapy at both 6 months and 12 months, 73 at 12 months, but basically 3/4 less injections for all comers. This, I should say, this was a relatively small study. This was only 17 patients, phase 1 data. The most important takeaway was safety. There was no intraocular inflammation. All patients did well, but there was a substantial reduction in the burden of disease. We also performed a subgroup analysis looking at patients who were supplemental free at 6 months. Basically, who are the patients who don't need additional therapy compared to those who did need additional injections. And the biggest take home is these were patients who had less fluid, better vision, and were less heavily treated in the prior year. So basically patients that were doing better didn't need supplemental injections, which is fairly logical. But this subgroup analysis really shows with data that those patients did quite well.
Well, does it matter if the patient's eye is dry at the initiation of treatment?
In terms of study enrollment, there wasn't any fluid criteria. We did find that the patients who didn't require supplemental injections tended to be drier. They had a mean CST of 255 microns. So these were certainly dry maculas that didn't require additional supplemental injections.
So what are the next steps for EYP-1901?
The next step is the top line data for phase 2. We're very confident that it's safe. At least that's certainly what the data says. There haven't been any safety signals thus so far in the phase 2 study. And then really looking at the efficacy and durability. This was a larger study. I want to say about 60. And then we'll see what it says in phase 2 before, hopefully, fingers crossed, moving on to phase 3.
So does this have a role in the management of diabetic retinopathy and vein occlusion?
So we are actively investigating the role within diabetic retinopathy. There was a study for severe non-proliferative diabetic retinopathy where we give an injection of EYP-1901 alone without anti-VEGF therapy. And that study is active and ongoing. We haven't investigated retinal vein occlusion, but I'm sure there will likely be a role just given the mechanism and success of other anti-VEGF agents.
What about diabetic macular edema?
That's not something that we have looked at yet. I could certainly see us looking at that in the future.
Well, Philip, a great discussion about something that's very promising. Thanks for participating on Retina Synthesis, and we'll stay tuned. You can update us on Davio 2.
Absolutely. Thank you so much, Carmen.